Good morning. Today we are talking about foam rolling still. We have previously looked at foam rolling the thigh and foam rolling the calf. Today we're looking at how to foam roll the back of the hip and even the front of the hip and the side of the hip here. It can be really useful to foam roll rather than just stretch, so that you really target the small pockets of muscle that are very, very tight. The foam roller that I like to use, as you will have seen if you've seen my other videos, it's 90 centimetres long, it's 15 centimetres in diameter, and it's quite firm. You can get softer ones if your muscles are particularly tight or sensitive, and the softer ones work very, very well for you. If you are a glutton for punishment, you can get trigger point foam rollers as well, which have sort of knobbles or ridges on, which go that little bit deeper into the muscle belly as you're rolling over it. But as I say, I'll be starting with this one, and we're looking at the hip. So predominantly we're looking at the glute muscles that come from your sit bones and sort of blending into your hamstring muscles and your ITB, and they come all the way back to, if you find your pelvis, the top of your pelvis, they come all the way up to here and all the way back to your spine. They're a huge muscle group. Gluteus maximus is the biggest muscle belly in the body, so it's important not to ignore it. Having strong but flexible glutes will really help prevent a lower back pain or niggle if you get it. So making sure that you can foam roll the whole of the leg, but including the glutes, will make a big difference to that. So how do we start? I like to start with a foam roller just coming behind me, and my hands I lift up and I sit on the foam roller. So there's no sort of awkward postures or positions to get into. If you start just in the middle, so the weight's nice and evenly distributed across both sides, you'll be coming onto your sacrum and your coccyx. If that's uncomfortable at all, there's no need to sort of hang around in this area. It's just to get that central attachment through there. So if I work through my right glute here, I just roll slightly further onto it. My feet are giving me a nice balance at the front. My hands are giving me a nice balance at the back. And you come all the way up, and you do need to come all the way to the top of your pelvis. If you miss that and you're just rolling around in the middle, you'll miss a really important part of your gluteal muscles there. So coming all the way up to the top and all the way to the bottom. So it feels like you're going into your thigh, but you're just rolling up to your ischial tuberosities, those sit bones at the bottom there. And as you come up and down, if you find a particular area of tension, just work through it nice and slowly, going over it a few times. As it loosens off, you can move across. So what will happen is, as you start rolling around, you'll become more on your side. At some point, you'll find that you need to readjust. That's absolutely fine. So you're coming all the way to the top of the pelvis and all the way down. Now, at this point, I'm going to readjust. So I'm coming much more onto my side. This gets your TFL muscle, which is right on the side there. If you have ITB problems, making sure this is nice and loose will be invaluable. It's really important to make sure that you can keep this muscle flexible. It enhances the way the glutes work. It also enhances the stability of your hips if it's flexible and able to work properly. So do work through it. And if you have a problem with it, you'll find this is very painful. So again, coming all the way to the top of the pelvis there and all the way down. You'll come to your there's a sort of knobble of bone right on the side there. That is part of your femur, femoral head as it sticks out. So it's called the femoral trochanter. So don't roll over it because it can be quite uncomfortable and feel very bruised, but do go all the way down to it. And then again, if you roll slightly more into your front, you'll get the edge of your hip flexors as well, which are really important to include if you're rolling your legs or your glutes. All the way down into the start of your hip flexors. And then come off, and then just sit down on the floor. And that is as easy as that to release all of your glutes. So 5 minutes will get both sides of your pelvis and your glutes. Enjoy. If you have any problems, make sure you speak to one of us at Swan Osteopathy. Any questions, we can give you advice as well as treatment, and we're always happy to help. Thank you.